So our lesson for today is about the patient care partnership, understanding expectations, rights and responsibilities. Okay. So basically our objectives at the end of the presentation, you will be able to explain what this patient care partnership is all about and provide a brief history of uh, how this uh, partnership came into being and uh, the output that I will be looking for at the end of this presentation ay may kinalaman sa ano naman sa Philippine setting. Kasi this patient care partnership is based on the American setting. So what is it for us? Anong meron sa Pilipinas? So yun yung magiging output ninyo. Okay? So brief history of patient care partnership. So nagumpisa ang patient care partnership dahil sa American Hospital Association. Okay. So yung kanilang management advisory noong 1973 ay nag-present ng Patients Bill of Rights. Okay? So ito ay inadapt nga noong 1973. Okay. Itong Patient Bill of Rights na to ay kinabibilangan ng mga 12 to 13 Bill of Rights. Okay. And then it was revised and approved by the Hospital American Association's Board of Trustees in October 1992. At ito nga yung summary ng list ng Patient Bill of Rights noong 1992. Okay, so number one, considerate or right to a considerate and respectful care. Then number two, right to be informed completely and understandably. 3. Right to refuse treatment. 4. Right to have an advance directive. Example, a living will. Healthcare proxy. Okay? Or yung tinatawag natin na designated surrogate. We discussed designated surrogate doon sa ating informed consent. Okay? Then, right to describing the extent of the care desired. Okay. Then, right to privacy and confidentiality, 5 and 6. Then, 7, right to the patient's record. Access to the healthcare information. So, ito yung first 7 na laman nung 1992 AHA Patient Bill of Rights. So, considerate and respectful care. So, yan yung number one kasi it is the priority or it is the mission of the hospital to provide humane treatment or care. Then, syempre, yung number two, kailangan or karapatan ng pasyente na ipaalam sa kanila yung mga bagay na may kinalaman sa kanilang kalusugan, sakit, saka dun sa treatment at plan of treatment. At ito, refuse treatment, hindi lang treatment kundi pati diagnostic procedure. May karapatan sila na tumanggi. Itong advance directive. So ano ba yung example ng advance directive? So bukod dun sa living will and healthcare proxy, ito yung mga maririnig natin na DNR or DNI. So ano yung DNR? Do not resuscitate or do not intubate. So siguro marinig niyo sa mga news na may kinalaman sa COVID-19 na there are some healthcare providers or healthcare workers na nagkasakit ng COVID na meron silang advance directive na do not intubate. Ayaw nila na magpa-intubate. Okay na sa kanila na mamatay as long as na hindi sila ma-intubate or mas okay na mamatay kaysa ma-intubate. Yun yung isa sa example ng advance directive. Okay? Then privacy. So when we speak about privacy, hindi lang yan physical privacy, kundi pati sa lahat ng information or procedure. So, ganun din yun sa confidentiality. Okay? So, continuation. So, has the right to request appropriate and medically indicated care. So, pwede siyang mag-request ng pasyente ng particular care as long na it is appropriate and medically allowed. Okay? Then know about the institutional business relationships that could influence the treatment and care. So anong example natin dito? Example natin dito yung mga mga researches. Okay? So there are some patients na nilalapitan, usually yung may mga unique cases, nilalapitan sila ng, let's say, ng doktor nila, at sinasabihan sila na may ganitong study or research regarding a particular drug, kung gusto nyo sumali, so we can have you enrolled. So yung mga ganon. So may karapatan si patient na malaman kung ano bang relationship ng hospital doon sa pharmaceutical company halimbawa. So, yan. Then, be informed of consent to or decline participation in proposed research studies. Yan nga yung sinabi natin. Okay? So basically yung number 9, 10 saka yung nasa unahan kanina ay may kinalaman sa patient's right to informed consent. Then number 11, continuity of care. Kailangan may karapatan ng pasyente sa patuloy na pag-aalaga kahit na ang pasyente ay walang pambayad. Diba? Kaya nga, kung ang isang pasyente walang pambayad sa ospital, di ba anong nangyayari? Tumatakbo lang yung bill. Hindi nila ma-force na mapabayad ang pasyente. Kung ayaw naman nilang palabasin, lalaki ng lalaki ang bill ng pasyente. Okay. Be informed of the hospital policies and procedures relating to patient care treatment and responsibilities. Okay, so, information pa rin. So yan yung 12 nilalaman ng Patients Bill of Rights noong 1992 ng American Hospital Association. Okay. So, nasan dun yung patient care partnership? Okay. So the AHA recently placed the Patients Bill of Rights or replaced the Patients Bill of Rights with the Patient Care Partnership, Understanding Expectation, Rights and Responsibility. So pinalitan na ng American Hospital Association yung kanilang Patients Bill of Rights ng Patient Care Partnership, Understanding Expectation, Rights and Responsibility. So actually, this patient care partnership, this is a brochure. Isa siyang brochure. Okay. Brochure siya na naglalaman nitong mga statements regarding ano yung expect ng pasyente na mga mangyayari sa kanyang hospital stay. Ano yung kanyang mga karapatan at ano yung kanyang mga responsibilidad. Ito ay sinulat gamit ang layman's term or plain language. Okay? So, yan nga. So, this partnership or patient care partnership includes the essentials of the Bill of Rights in plain language and reviews what the patient can and should expect during the hospital stay. Okay? So again, isa siyang brochure. So, what to expect during your hospital stay or the patient's hospital stay. Yan. High quality hospital care, number 1. Number 2, a clean and safe environment. Number 3, involvement in the patient's care or in your care. Protection of your privacy, help when leaving the hospital, and help with your billing claims. Okay. So, basically, yan na yung summary na kung ano yung nilalaman ng patient care partnership. Okay? So, napakakonti, di ba? Compare mo doon sa 12 patient's Bill of Rights. Pero sabi nga, this patient care partnership encompasses all the essentials of the patient's Bill of Rights. So, ibig sabihin, sa bawat isa dyan, sa mga criteria or sa mga sections ng patient care partnership, nakapaloob yung mga ideas, mga theories, okay, or mga ideologies ng mga rights ng pasyente. At the same time, mga responsibilities of the patient. Okay? So, isa-isahin natin. So, high quality hospital care. Siya yung nauuna. Katulad ng binanggit natin kanina, dahil ito yung kauna-unang priority ng hospital. Ano yun? To provide quality care or to provide treatment sa pasyente. Diba? Kasi bakit ba naman pupunta ang isang tao sa isang hospital? Diba? That is for care and treatment. Okay? So, first priority is to provide the patient with the care they need when they need it with skill, compassion, and respect. Kaya nga siya ay high quality care. Hindi lang skill, nandiyon din yung compassion and respect. Okay. So, kasama dito na dapat sabihin ng pasyente sa kanilang mga sa mga healthcare workers yung kanilang mga concern about sa kanilang care. When we say care, ito yung paraan na dinideliver sa kanila yung, let's say, treatment or sa pagdadiagnose pa lang, di ba? Or sa kanilang recovery, care, pangangalaga, or kung mayroon silang nararamdaman na anything like pain. So, it is their duty. Okay? Responsibility ng pasyente. Okay. And also, the patients have the right to know the identity of caregivers or the healthcare workers. Kaya nga, bago tayo mag-perform or when we greet patients na pumapasok or bago natin sila i-x-ray or mag-perform ng any procedure or magbigay ng instructions, okay, we introduce ourselves. Diba? Uh, Hi sir, hi ma'am, I'm ganito, I will be your, halimbawa, CT scan technologies, I will be your radiographer, I will be your ultrasound technologies, etc. So mga ganon. Karapatan nilang malaman yung ating pangalan. Or whether yung mag-a-assist sa kanila na caregiver or healthcare part ng healthcare team ay estudyante ba, residente ba? When we say resident, they are doctors in training or other trainees like let's say staff under probation or yung newly hired pa lang. So dapat alam ng or magkarapatan ng pasyente na malaman yun. Okay? So malinaw ba yung sa high quality care? Okay, so next is the clean and safe environment. Okay, so pinag-aralan natin before yung ating occupational uh, health and safety plus the patient safety and mechanism on reporting incidents. Okay, so hospitals use special policies and procedures to avoid making mistakes in care. So binibigyan din yan ng mga ng brochure ng ating patient care partnership in order for the patient to uh, feel more safe and reduce or avoid being anxious. Okay. Free from neglect and abuse. So binibigyan ng guarantee ng hospitals, okay, that the patients will not encounter any neglect and abuse from their staff. Okay? Then right to information about anything unexpected that occurred during the hospital stay. So karapatan pa rin ng pasyente na malaman kung may nangyaring hindi inaasahan during sa kanilang stay kahit na wala namang nangyaring harm or injury. So, nasa karapatan pa rin ng pasyente yon. Okay. So, my question, okay, so let us move forward. Okay, so next, involvement in your care. So, it elaborates on patient discussion, understanding of their conditions and treatment choices with their physician. So, kailangan involve natin yung pasyente sa decision making. Okay, so anong principle ng ethics ito? When you involve the patient in decision making, if you are a healthcare worker that involves the patient in decision making, then you are practicing what kind of ethical principle? Hala. Nakalimutan na. You are practicing what? Ano na? You are practicing autonomy, patient's autonomy. Okay? Then the patient's responsibility to provide complete and correct information to the caregiver. Okay. So ito ay nakita natin na naging problema during the pandemic, 'di ba? Yung mga nagtatago ng kanilang sakit. Kaya imbis na makatulong, so ano nangyayari? Nakakapanghawa pa ng ibang tao. Lalo na yung mga tao na uh, during the lockdown ay nagmamadaling lumabas ng Manila. Diba? Or example nito, doon sa isang vaccination site, may nagpa-vaccine, okay? May sintomas na pala ng COVID. Pumila siya doon, so anong consequence? Nakahawa siya ng mga vaccinators and other healthcare providers. At the same time, nakahawa rin siya ng ibang tao na nagpapabaksin. Diba? So, kaya malaking emphasis dapat ang ibinibigay doon sa education tungkol sa hindi lang sa rights ng pasyente, kung hindi pati sa responsibility ng pasyente. Lalo-lalo na yung to provide complete information and correct information. Okay? So regarding their health. Okay, then understanding who should make the decisions for the patient if the patient cannot make those decisions, including living will or advance directive. Okay, paano kung walang living will or advance directive? So, the nearest of kin or the legal guardian. Okay, so yung pinag-aralan natin sa informed consent. Okay, then, so advance healthcare directive or living will. So persons or preserves a person's right to make decisions regarding their own healthcare. Names the individual authorized to make all healthcare decisions for them. Okay, so living will yun. Okay? Yan. Can include specifics regarding DNR or DNI and other end-of-life decisions. Okay? So itong DNR, naka-witness na ako nito sa mga TIMED. Do not resuscitate. Nung nag-code red. Nung nag-code red, nandun na kami kukunan dapat na x-ray. Pero instead na mag-perform ng CPR, hindi na nag-perform kasi nakalagay dun sa chart ng pasyente na DNR, do not resuscitate. Instead, binunot na lang yung plug ng automatic ventilator. So, yun, DNR. So, we must respect the decision of the patient by via advanced healthcare directives or living will or their surrogate designated surrogates. Then protection of the patient's privacy. So respects the confidentiality of patient's relationship with their doctor and other caregivers. Okay. Sensitive information about patient's health and healthcare are part of that relationship. So any information na may kinalaman sa health ng pasyente, okay, status ba yan, diagnosis ba yan, or result ng mga diagnostic procedure, they are all sensitive information. And of course they are protected by privacy and confidentiality. Okay. So dito sa US, okay, under the patient care partnership, okay, ang mga pasyente ay binibigyan ng notice of privacy practice or practices. Ano itong notice of privacy practices? So this is a notice that describes the ways on that the institution or the hospital use, disclose, and safeguard patient information. And that explains how you can or how the patient can obtain a copy of information from the hospital's records about the patient's care. So yun, doon sa hospital, talagang ini-inform ng mga pasyente kung saan ginagamit yung mga data, kanino lang pwede i-disclose yung mga specific data, ano yung ginagawa ng hospital para protektahan yung kanilang information, yung kanilang data, at paano pwedeng makahingi ng kopya ang pasyente ng record niya. Diba? Dito, sa atin hindi. Minsan, mahirapan ka pa magtanong. Susungitan ka pa ng either ng nurse or ng nasa information. Diba? So yan ay part ng uh, patient care partnership. Okay? So let us continue. So far may tanong ba? Before we continue pala, may tanong. Okay, so let us continue. Help when leaving the hospital. Okay, so ano ba to? Patients can expect to receive information and where possible training about self-care the patient will be needing when the patients go home. Okay, so ano pa yung other? The hospital will also help in finding availability of or instruction regarding follow-up care or follow-up check-up, mga ganyan. So yan ay karapatan ng pasyente at responsibilidad ng ospital. Okay? Then last, help with your billing claims. So the hospital staff will help patients by filing claims with insurance companies. So dito sa atin sa Philippine setting, usually ganun din naman. May mga staff, hospital staff na naka-assign sa mga HMOs. Ano yung HMOs? Health Maintenance Organization or simply called health insurances. Okay? So may mga naka-assign na hospital staff. Okay? And usually, sila yung nagpa-file ng insurance claim. Okay? So, sa PhilHealth, ganun din. Then, providing patient physicians with required documentation Okay, so part pa rin yan ng patient claims or insurance claims. Then answering patients' questions and assisting those without health coverage. So yan yung kabuuan ng patient care partnership. Understanding, uh, yun? Understanding expectations, rights, and responsibilities. Okay? So from a patient bill of rights to patient care partnership. Okay. Now, how about in the Philippine setting? Okay. So, in the Philippines, okay, meron tinatawag na Philippine Magna Carta of Patients' Rights and Obligations. Okay. So again, sa Pilipinas, meron tayong tinatawag na Magna Carta of Patients' Rights and Obligation. However, ito ang inyong gagawin. Make a research about the Philippine Magna Carta of Patients' Rights and Obligations. Ano naman niya? Its origin. Yun, hindi ko pa natapos. Sige, tatapusin ko na lang. Okay?